Cystic fibrosis is a genetic disease that causes progressive lung disease and malnutrition due to a faulty protein called the CF transmembrane conductance regulator protein, or CFTR. CFTR is a chloride channel present in the airways, gastrointestinal tract, and sweat glands, among other organs. In sweat glands, sweat is secreted into the sweat duct and travels to the skin surface. Cells lining the sweat duct contain CFTR channels, which allow chloride back into the cells. In people with CF, the CFTR channel does not work, and chloride and sodium remain in the duct, causing salty sweat. CF can be diagnosed by measuring the concentration of chloride in sweat. Most people with CF will have chloride concentrations greater than or equal to 60 millimoles per liter. Sweat chloride concentrations between 30 to 59 millimoles per liter are considered intermediate and require further evaluation. The quantitative pilocarpine iontophoresis test, or sweat test, is considered the gold standard for diagnosing CF. Performing the sweat test accurately is critical to making a timely diagnosis. Although there are different ways to analyze sweat, QPIT is the only CF Foundation-approved sweat test method for diagnosis of CF. Sweat tests are recommended for infants with a positive newborn screen who may or may not have CF, but who need a sweat test to determine the diagnosis. Infants with a presumptive diagnosis of CF based on newborn screen and 2 CFTR gene variants known to cause CF. Children or adults with symptoms concerning for CF. And infants with a diagnosis of meconium ileus. Sweat testing may also be done for people with CF who take CFTR modulators to monitor how the medication is affecting their sweat chloride levels. Some important things to keep in mind before starting the sweat test are: ensure that the individual is well without fever, vomiting, diarrhea, or dehydration. Do not perform the test on a patient receiving oxygen by an open delivery system. Oxygen may be delivered by nasal cannula during the procedure if needed. Encourage adequate hydration, including frequent feedings for infants. Consider allowing infants and children to drink during the procedure. This can help with hydration and with distraction. And confirm that no lotions were used on the skin in the past 24 hours. Before the appointment, provide clear pre-collection instructions to the parent or guardian. Instructions should include an overview of the procedure, when to expect results, and important preparation steps, such as ensuring the child is well hydrated, not sick, and has avoided using creams or lotions. When scheduling sweat tests for infants, consider scheduling in the afternoon. This allows time for multiple feedings early in the day to improve hydration. For toddlers and older children, you may suggest that caregivers bring a tablet or device with the child's favorite show to provide entertainment. This can provide helpful distraction and reduce anxiety during the test. The sweat test is made up of 3 distinct sequential steps: induction, collection, and lab analysis. In this video, we will demonstrate induction and collection following CLSI guidelines. Sweat is induced through iontophoresis of pilocarpine using a low-voltage electrical current to stimulate sweat production in the sweat gland. The procedure is generally not painful, but patients may have a tingling sensation. Minor burns and allergic reactions are possible and should be planned for, but are rare. Sweat induction is performed on one side of the body and then the other, never at the same time, and current should never cross the heart. Remember to always wear personal protective equipment following your institute's guidelines and CF-specific infection control for patients known to have CF. In this video, we will demonstrate sweat testing device use. This video shows a Macroduct Advanced Device Model 3710, but the same steps for induction and collection also apply to the earlier model 3700. This system includes an inducer with a touchscreen that will walk you through each step. A battery charging power supply and power cord are included. Be sure to charge and unplug the device before the patient arrives. The electrode cable assembly includes a red and black electrode. Other equipment include 4 pilocarpine gel discs, 3 to 4 electrode and collector straps, 2 coiled tubing collectors, 2 small sealable containers for sweat, and a rack to hold them upright, nippers, clinical laboratory reagent water, either a sweat dispenser or TB syringe with blunt-tipped needle, gauze or laboratory tissues, alcohol swabs, self-adherent elastic wrap, which is useful especially for testing young children, timer, in addition to the built-in timer in the inducer, and a pen and paper. Setting up in advance is helpful, especially with infants or toddlers. Preparing some of the collection supplies before the patient arrives, rather than during the 5-minute induction window, can make the process smoother since your hands may not be free during induction. We'll walk you through the setup. Inspect and clean the electrodes with alcohol wipes, rinse with CLRW, and dry. We will be using a syringe for the collection process, which can be prepared ahead of time as well. Begin by attaching the blunt needle to the syringe. Pull the plunger back about halfway. This draws in enough air to expel the sweat from the coil tubing after collection. Once prepared, return the syringe to its protective wrapper. If other equipment is used for removing sweat, follow the manufacturer's instructions. Next, pre-attach a strap to each electrode. A tip for infants and toddlers, you can cut straps in half for a better fit. You can also pre-attach a strap to one side of each of the collectors. To attach the strap to the collector without compromising sterility, carefully cut the end of the plastic wrapper, keeping the rest intact. Attach the strap while keeping the collector clean and protected by the wrapper until it's ready to use. When meeting the family, take a moment to provide a brief overview of the procedure. Let them know the procedure typically takes about an hour. While the test isn't painful, children may feel a mild tingling or warmth at the site. It's also normal for some young children to cry or become upset. Preparing caregivers for what to expect can help reduce stress if the child becomes fussy. Before starting the sweat test, it's important to confirm the patient's identity with 2 identifiers to make sure the specimen is collected from the right patient. For infants and small toddlers, having a caregiver hold the child during the procedure can be very helpful to offer comfort, help keep the child in position, and allow the caregiver to assist in keeping the arm still. If holding the child isn't feasible or preferred, laying the infant on an exam table is also an appropriate option. Let's get started by powering on the device. The date and time will appear at the bottom of the screen. The first screen will display the iontophoresis supplies, and you can use the green arrow to advance the screen. Next, you'll be prompted to enter the required information. The kit number can be found on the gel disc container. If this information isn't required, you can bypass this screen. Select the skin areas for electrode placement. The middle section of the inner side of the forearm is preferred as it has the highest density of sweat glands. Make sure the area is free of breaks, fissures, or other abnormalities like scars, as wrinkle-free and hairless as possible, reasonably thick musculature, and not too close to wrist tendons or bone. Also make sure the area is large enough for 2 electrodes. The second electrode may be placed on the upper arm. If the forearm is not suitable, the thigh can also be used. Remember that both electrodes must be on the same side of the body to prevent the current from crossing the heart. Clean the skin vigorously with alcohol swabs and then rinse with CLRW and dry the skin. Next, advance the screen and add a gel disc to each electrode. It's normal for the gel disc to bulge slightly. Be sure to inspect the gel discs for any cracks or bubbling and discard if present. Gel discs should never be frozen. Never place the electrode on the skin without a gel disc in place, as this can cause burns. The skin where the electrode with gel disc will be placed should be slightly wet, so you can either add a drop of CLRW to the skin or to the gel disc and then place against the skin. Start by placing the red electrode first. Secure the strap firmly, but not so tightly that the gel disc is crushed or circulation constricted. If the gel disc is too loose, sometimes there is more irritation to the patient during induction. If this occurs, tightening the strap slightly may reduce discomfort. Next, repeat the process to prepare and place the black electrode. The electrodes should not be touching each other, and the skin between them must remain dry to prevent the current from traveling across the surface. If needed, gently blot the area dry. Follow the instructions on the screen until the induction is started. The induction will run for 5 minutes. During the stimulation phase, distraction is especially important for toddlers. Gently massaging the hand can help take their focus off the tingling sensation, and having a movie or show playing can also be a great way to keep them calm. Encourage the parents or guardians to bring a bottle for infants and toddlers. Feeding during the procedure not only soothes the child, but also supports proper hydration, which is essential for an effective sweat collection. Use this time to organize your collection supplies and prepare any supplies that you haven't already prepared. Also, monitor the limb closely throughout the stimulation period for any signs of impaired circulation, such as cyanosis, bluish discoloration, swelling, or unusual paleness. If any of these signs appear, stop the test immediately. Once the induction is complete, remove the black electrode first, then the red electrode. Once the red electrode is removed, rinse the area with CLRW and dry completely and advance the screen. The device will display the supplies you will need for collection. Advance through this screen. Place the collector over the same area where the red electrode was placed. You may see an area of redness at the site. Make sure the collector is flat against the skin. There should be small pillows of skin showing on each side of the collector. Start a 4-minute timer and watch for sweat to appear in the coil. This is the blue dye seen in the coil. If no sweat appears after 4 minutes, begin timing the collection regardless for 30 minutes. Check that the collector is tight enough by pressing the collector firmly against the skin. If sweat in the tubing moves by more than 2 to 3 millimeters, attach the strap more firmly. The collector should not be placed too tightly, as that may block sweat from entering the coil. For infants and toddlers, wrapping a self-adherent elastic wrap or paraffin wax sheet around the collector can help maintain contact with the skin and keep the collector in place. You'll need to unwrap to take a look underneath throughout the procedure. Start the timer and document the start time for collection. As always, carefully monitor the limb for any signs of compromised blood circulation, such as cyanosis, swelling, or unusual paleness, and discontinue testing if any of these conditions occur. Once the first collector is secured and the collection begins, you may proceed with sweat induction on the opposite side to collect the second specimen. Remember, induction must only be performed on one side of the body at a time. Never induce both sides simultaneously, and always avoid allowing current to cross the heart. When beginning induction on the second side, you may either use a second inducer or reuse the same one. If you are using 2 inducers, the built-in timer on the device may be used. If you're using the same inducer for both sides, note that it is only configured for one sweat test at a time, so you will need to use an external timer for the first collection. To prepare, advance through the device screens until you can exit and return to the home screen. Once there, you can begin the induction process on the opposite side to collect the second specimen. Sweat should be collected for no more than 30 minutes. If sweat is approaching the end of the coil, the collection can be stopped early. Be sure the sweat does not reach the end of the tubing or overflow. To start the sweat transfer process, begin by removing the cover using the nippers, and using the nippers, lift the end of the coil and gently lift upwards to uncoil. Once the coil is unwound a few centimeters, insert the syringe needle 2 to 3 millimeters into the end of the coil. Continue lifting the coil until it's fully unwound. With the tubing held upright, verify the sweat rate by checking the volume of sweat collected against the black indicator lines on the tube. Then tap the corresponding sweat rate on the touchscreen. The minimum sweat volume is 15 microliters per specimen, and adequate collections are also indicated by black lines on the coil. We recommend sending all specimens to the laboratory for volume assessment. Do not remove the collector from the patient before collecting the sweat specimen. A vacuum can draw the sweat from the tubing and reduce the specimen volume. Make sure the small collection tube is ready for transfer. Cut the tubing at the base and immediately move the coil to the microtube. Gently press the plunger to dispense the sweat into the microtube and secure the cap tightly. Document the time the collection is complete. Place the microtube into a carrier tube. The specimen should be labeled with 2 patient identifiers and an indication of the collection site, either left side or right side. Immediately send for analysis following your institute's guidelines. Collecting 2 specimens from different sites is recommended to provide quality assurance and reduce the chance of obtaining an insufficient specimen. Specimens from 2 sites cannot be pooled for analysis. Detach the collector from the collection site. Rinse with CLRW and dry. Remove and discard the gel discs. Follow your institute's infection control policy for cleaning any reusable equipment. If using a reusable needle, clean with CLRW and let it dry. Clean the electrodes, nippers, and straps if being reused with alcohol wipes. Rinse with CLRW and dry. Never use bleach to clean equipment as it contains chloride that can contaminate future collections. Disinfect equipment according to your institute's infection prevention control and manufacturer policy. Thank you for watching. We hope this video has provided a clear and useful overview of the sweat induction and collection process, along with practical tips to support a successful procedure. Following standardized guidelines and preparation steps ensures reliable sweat chloride results and a more comfortable experience for patients and families. For additional information, refer to the 5th edition of CLSI Guidelines C34, Sweat Testing, Specimen Collection, and Quantitative Chloride Analysis, and follow the manufacturer's recommendations for your equipment within the user manual. You can also email CFF Center Assist at cff.org with any further questions.